Dentists spend their careers fixing our health, while their own bodies endure significant physical strain. These musculoskeletal disorders, or MSDs, often degrade nerves and joints until practitioners are forced into early retirement. Dr. Tammy del Sol reached this point after nearly 30 years in general dentistry, battling severe carpal tunnel and trigger thumb. The tools of her trade were causing physical damage, leaving her facing surgery and the potential loss of her practice. Her father, Dr. Victor Hajar, began his dental practice in downtown Harrisburg, Pennsylvania, in 1959. Along with his 50-year career, he was an inventor who approached the mechanical limitations of his equipment with an engineering mindset. When her own career was threatened, Dr. Tammy applied that same perspective. She stopped accepting the pain and looked for a solution. Drawing on her father's influence, she converted her medical leave into a focused effort to redesign her tools. During her recovery and the subsequent COVID-19 lockdowns, she used her living room as a laboratory for her prototypes. She identified the primary cause of her injury, the smooth, narrow metal handles that have been the industry standard for decades. This diagram shows the pinch force in action. Because the handles are slick, dentists must squeeze inward with significant pressure to maintain a grip. Over time, this constant inward pressure sends repetitive stress directly into the thumb base and carpal tunnel. This pain is the direct result of a design flaw in the physics of standard dental instruments. Solving the problem required a way to transition the hand's effort from a high-pressure pinch to a more relaxed latch pull. The development phase involved multiple iterations, including an early prototype based on the shape of butterfly wings. The final patented design is a customizable silicone attachment shaped like a star, featuring 5 distinct flutes. As shown, the star's points act as a ledge, allowing the fingers to hook onto the tool and use a pulling motion instead of a pinch. The fluted design maintains tactile feedback, letting the fingertips' nerve endings sense and rotate the instrument. These attachments slide onto most existing dental tools and are built to withstand 275-degree autoclaving. The HErD star addresses the occupational hazard by changing the physical interaction between the clinician's hand and their equipment. Clinical feedback from hygienists and surgeons suggests that using the attachment provides immediate relief from chronic thumb pain. This practical solution was granted a utility patent by the USPTO in May of 2025. Dr. Tammy attributes her persistence to her mother, Maya, a Finnish immigrant who embodied the concept of sisu, or indomitable spirit. The company name, HErD Dental, and its reindeer logo are tributes to this Finnish heritage. Since female reindeer are the only deer species to grow antlers, they serve as a symbol of strength. It took her father's technical mindset to see the flaw, and her mother Sisu to bring the solution to market. Dr. Tammy redesigned the grip to provide clinicians with better ergonomics. By reducing the physical toll of the profession, she aims to help their hands last a life.